My name is Lori Cole. I'm the Executive Director of the New York State Council for Community Behavioral Health Care. We are 175 mental health and substance use providing organizations in community-based settings across New York State. And today, I am so proud to be here joined by my peers, by my colleagues who are all here today to talk about and to press lawmakers into action on a bill, A8309A, and in the Senate, it's S8055A. This is a bill that would remove most mental health and substance abuse services from the state's Medicaid Managed Care program, a program that carved our services in to a type of management of services for individuals with significant mental health and substance disorders over a decade ago. Medicaid Managed Care is drowning providers, and it is an absolute barrier to care for New Yorkers with significant mental health and substance use disorders. Allowing insurers, who are primarily for-profit insurers, to manage hundreds of millions of dollars that are supposed to be spent on actual care for Medicaid beneficiaries is in no way efficient, effective, and it has been dragging our system down to the point now where there are stunningly long waiting lists for care in communities across the state. We all represent different parts of the stakeholder system. Some of us here today represent families, others of them youth, children, etc., and we are all suffering at the hands of insurers who are paid $400 million a year by this state simply to manage care. And what that turns out to be over the last 10 years is a pattern of delaying and denying care and delaying and denying reimbursement to the providers who serve vulnerable New Yorkers. So one by one, each of us will talk about what this means from our particular perspective, but make no mistake, we are a heterogeneous group representing tens of thousands of New Yorkers with mental health and substance use conditions who rely heavily on community-based care to get their services and supports, to keep them in the community, to keep them gainfully employed, to keep them happy and living quality lives. So with that, I will pass it to Paige from Families Together. Paige is the CEO of Families Together in New York State.
Thank you, Lori. As Lori said, I represent Families Together in New York State. We're a family-run and youth-run organization that represents the voice of families of children with behavioral health needs. So with that, our families have been saying for really a long time, but especially since Medicaid Managed Care has happened, that they are having a difficult time accessing health care, mental health care for their child. The reason for that, the waiting lists, are because of what Lori just talked about. Providers cannot possibly provide the kind of services that are needed when they're spending most of their time doing administration. At Families Together, our motto is nothing about us without us. That philosophy is that we have an expertise, because of our lived experience, that we can help share with policymakers so that they can better do their jobs in setting policies that will help make our lives better. So that's why we are here today with Lori, because we feel that if the care isn't available and people are having waiting lists, it impacts our child's lives. It is really a life and death situation for our families. It isn't just about getting a therapy session once every couple of weeks. It's not about that. It's about really life and death circumstances. Imagine for a moment that your child finally gets treatment and finally agrees to go to treatment, and then they get denied. And then you have to appeal. And then the appeal may or may not go through. At that point, the child may or may not still be ready to go into treatment, or they may not be alive. So that's why we're here. Lori, if I could pass it on to the next.
Thank you, Paige. That was great. Thank you very much. Next up is Luke Zucchini from the Alliance for Rights and Recovery.
Thank you very much. As Lori said, my name is Luke Sakini. I'm the Vice President of Public Policy with the Alliance for Rights and Recovery. We are a state and national mental health advocacy organization, and we know firsthand, as our staff and members are all folks in mental health recovery, how important it is to access services. We are here today because New York's behavioral health system is failing too many people, not because we lack effective services, but because we have built unnecessary barriers between people and the support they need by leaving behavioral health services in Medicaid Managed Care. For years, advocates, providers, and people directly impacted by the mental health system have warned that placing behavioral health services under Medicaid Managed Care was a mistake. Instead of improving access or outcomes, Medicaid Managed Care has created long waiting lists, denied or delayed services, endless paperwork, unpaid claims, and growing instability for community-based providers across New York State. Right now, people seeking mental health or substance use services are too often being told to wait weeks or months or sometimes even years for services. They have to navigate confusing provider networks that may not actually have available appointments or repeatedly seek prior authorizations just to maintain services they already need. These delays and barriers are not just frustrating, they are dangerous. When people cannot access mental health or addiction services, their needs escalate. We see more people ending up in emergency rooms, hospitals, homeless shelters, and jails simply because they could not get the right support at the right time in their community. We are forcing people into crisis instead of investing in prevention, recovery, and stability. At the same time, providers are struggling to survive under this system. Community organizations are dealing with chronic payment delays and endless billing disputes for services they have already delivered. Instead of investing resources into staff, peer services, housing supports, and direct support, providers are being forced to spend time fighting insurance denials and navigating bureaucracy. This contributes directly to the workforce shortages, burnout, program closures, and reduced access to services statewide. We cannot continue pouring money into a system that puts administrative costs and insurer profits ahead of people's health and recovery. That is why we at the Alliance for Rights and Recovery join other advocates here strongly supporting this legislation sponsored by Senator Brook and Assemblymember Simon. The goal is to carve behavioral health services out of Medicaid Managed Care and return them to fee-for-service. This is not just a fiscal issue. It's a human issue. Carving these services out could save the state hundreds of millions of dollars that can instead be reinvested directly into the community-based services, workforce development, housing supports, peer services, and crisis response systems that actually help people in recovery and thrive. I cannot state enough how this is about the people, not about profits or our system or providers entirely. This is about getting people the services they need when they need them and easing that process as much as possible, because we know when folks are struggling, they do not need to go through bureaucratic systems, but rather to get that support. We urge the legislature and governor to pass this bill and finally begin rebuilding the behavioral health system that puts people before bureaucracy. Thank you.
Thank you, Luke. Just to put a fine point on it, when you put hundreds of millions of dollars in front of insurers and you pay them in advance of when they need to lay out the money to pay for care for their beneficiaries, and you send them that money months in advance, they have choices about whether or not they send providers that money who have already rendered services, or they sit on the money. And increasingly, we see they sit on the money. This is unacceptable. This is a deprivation of resources for the OMH and OASIS systems of care that we desperately need. Next, I'll introduce you to Alice Bufkin from Healthy Minds, Healthy Kids campaign. Alice?
Hi, everyone. My name is Alice Buffkin. I am with Citizens Committee for Children, which is a children's advocacy organization. We also help coordinate the Healthy Minds, Healthy Kids campaign, which is a statewide coalition of children, adults, parents, caregivers, providers, and advocates fighting to ensure that all New York State children have access to the behavioral health supports they need. We don't represent providers. I'm here to talk about the harms that managed care causes to children and families throughout the state. At our organization, we care a lot about the data. We've done analysis that shows 3 in 4 children aren't getting the outpatient services they need. We've surveyed providers. 70 to 80% of outpatient providers have had to pause intake. Between 50 to 70% have wait lists for services. And the data, each of these incidents, these are children. These are families who are desperate for care, who cannot get them because our system is failing them. And the lack of access to care is not an accident. It is the result of conscious policy decisions that our state makes. One of the, and the failures of the systems that are supposed to serve our most vulnerable children and families. One of those systems that has failed families for too long is our managed care system. Since 2019, children's mental health and substance use disorder services have been administered through for-profit managed care companies. In this time, companies have made hundreds of millions of dollars in profits, supposedly to save state money and improve quality of care. And in that time, have outcomes for children and families improved? No. Have youth suicide rates gone down? No, they have gone up. Has the system become easier for families to navigate? Talk to any parent, talk to any young person trying to navigate the system. It is clear that the system has not gotten easier and access is harder than ever before. What has happened is that MCOs have denied claim after claim for needed services, have delayed payments for care, have introduced onerous administrative burdens for private providers to jump through. As a result, private providers are hiring staff and spending resources to chase down claims instead of spending that time with the children and families and adults. I speak for children, but this is an issue across all ages that they should be serving. In this time, more families have ended up on wait lists, in ERs, in hospitals. Suicide rates for young people have risen by 10% in the last decade. It's past time we cut out the middleman and stop funding for-profit companies to the detriment of families. The state should carve behavioral health services out of managed care. This would cause fewer administrative burdens, fewer denials, and fewer delays for providers, and allow them to center the children, the families, the adults, the community members throughout the state who desperately need this kind of care. Thank you.
Thank you, Alice. Next up is Chris Assini, who represents Friends of Recovery in New York State.
Thank you. Good afternoon. My name is Christopher Assini. I am the Director of Policy at Friends of Recovery New York. Friends of Recovery New York supports a network of community-based organizations and peer providers, and we represent the thousands of individuals living in recovery from substance use disorder. I myself is someone in recovery from substance use disorder. And the moment a person decides to begin their recovery journey is one of the most important decisions they will ever make in their entire life. When someone finally reaches out for help, they should not be met with delays. They deserve access to the care they deserve on demand. Far too many people with mental health and substance use needs are being forced to navigate a system that was never truly built to support behavioral health care. Attorney General Tish James found that 86% of behavioral health providers' directories were ghost networks, filled with providers who did not exist, are not accepting patients, or did not take the insurance listed. Yet, when people with substance use disorders appealed those claims to an external arbitrator, 64% of those claims were overturned, which is totally unacceptable. And that delay during that appeal process could result in a life loss. Meanwhile, community-based providers are spending hundreds of thousands of dollars every year just trying to navigate the managed care bureaucracy, hiring staff whose sole job is chasing reimbursement and fighting denials instead of hiring staff, expanding services, and reducing wait lists. These barriers impact staffing, delay services, destabilize programs, and ultimately hurt the quality of care people receive. The reality is the system is failing both providers and patients. We need to stop forcing people with substance use and mental health conditions to navigate a fragmented system with barriers and middlemen. Right now, the state pays insurance companies hundreds of millions of dollars annually to act as middlemen between Medicaid and behavioral health providers, while people in crisis struggle to access care. We need to put people over profits. Recovery is possible when we create systems that support it. Thank you.
Thank you, Chris. To put another fine point on it, Chris mentioned a statistic, and it basically is that when a care recipient, somebody with a significant mental health or substance use disorder, appeals an insurer's decision to deny services, if that individual has the guts and the courage and the time to take the appeal process all the way to the end, in 64% of the cases where there's an SUD or substance use disorder claim that was denied, it is overturned by an independent arbiter. On the mental health side, it's 52% of those appeals that brave care recipients take to the end of the appeal line and are overturned by people without skin in the game. That should tell you a lot about who we're dealing with. James Norton from National Alliance for Mentally Ill in New York, you're up next, and then we're going to hear from Senator Fernandez.
Thank you, ma'am. Again, my name is James Norton. I'm the Government Community Affairs Manager of NAMI New York State. That's the National Alliance on Mental Illness. We represent over 650 chapters nationwide of folks with lived experience and their family members with mental health issues. We started in the 1970s by two parents who felt that there weren't enough services for themselves or for their two children with schizophrenia. And today we're still fighting that same fight because everyone who went before me just talked about how they're having a hard time accessing services. We know nationally, $1 in $4 that pays for all mental health services, substance use services, comes from Medicaid. And we know that this system, the Medicaid Managed Care system, is denying that Medicaid service. We know that that is the number one payer for mental health services, and these Medicaid Managed Care plans are denying 60% of those cases. One thing we haven't talked about yet is that this also sets up a network effect. You can go, if you have Medicaid, to another Medicaid provider, and they won't accept you because you're not on the right Medicaid Managed Care plan. So as hard as it is to admit that you need help, as hard as it is to admit that you have a mental health issue, you're walking into a provider and still being told no, even though they take Medicaid and you're on it. That is not acceptable to us. All of these barriers harm everyone all across the state, whether it's the families, whether it's the communities that these people live in. They lead to higher statistics that we've all mentioned earlier in this press conference. And we know the state can do better, and we know that that system would be more efficient, help more people, and save the state more money. We need to do that today.
And now, Senator Fernandez, who has been a tremendous advocate and champion for mental health and substance use disorder services, and is here with us today to talk about a bill that she's co-sponsoring that I mentioned earlier. Senator?
Thank you. Good morning, everyone. Thank you to each of you for being here today. Thank you to Senator Brooke for leading this bill. We miss her. I hope she comes back soon. But the purpose of this bill is so instrumental to the work that she does as the mental health chair and the work that I do as chair of substance use disorder. You've heard the testimonies, the stories. Apologies for my tardiness, but I know the pain. I've seen the sadness, really, and the despair that comes when people are turned away, when providers like yourselves just can't provide the help that people are coming to receive. And as it's been said, that is a huge first step to say you want help, to go even to an office, to speak to somebody to get the help. But then when it comes to the insurance part, you got to walk away. And it is hurting too many people. It is delaying so much progress that we could be having, that we could be creating, so much success, so much life to continue to live. And this bill is removing that middleman. We know in every example when there's somebody in the middle, time is stretched, delays happen. And the fact that there are people that are being turned away in their most critical moments, in those moments where we need to grasp onto them, where we need to make sure that they are getting that help immediately. We are doing a disservice as a state by not passing this bill. We are doing a disservice as leaders, as providers of this work to not fight for this. And it is my goal that in this session, the next couple days that we have, that we push this bill and see it pass in both houses, because the help cannot wait. The delays cannot continue. People need help. They need these services. And to keep this blockade in place that we very clearly see, is only making ourselves look foolish. How could we stand here and say we are doing everything we can to connect people to care and to services when this is happening? So I really do thank our sponsors on this. I am a proud co-sponsor. And in place of Senator Brooke, we will keep pounding the drum to see that this bill moves forward and that we can change a system that we see and know is broken. Thank you to everyone here for standing in this coalition, for ringing the bell, for bringing this to awareness, because it is your actions that will ultimately succeed in getting the action of the governor to sign this. And I'm grateful to be a partner and looking forward to the work ahead, and we will not stop until this is done. The system, as we said, is broken, and the only way to move forward is by fixing it, and that is with this bill. So thank you so much for having me. Thank you so much for the press for giving attention to this, and let's make sure that we all can see and know what needs to be done, and that is passing this bill. So thank you so much.
Next up is Allegra Shore, and I will allow her to introduce herself to you with her long association name.
Thank you. Thank you, Lori, and everyone, especially thank you to Senator Fernandez for her incredible leadership in our field. I'm Allegra Shore. I'm the president of COMPA, which is the Coalition of Medication-Assisted Treatment Providers and Advocates. And I'm also here to talk to you as a provider. COMPA represents opiate treatment programs throughout the state. That's hospitals as well as community programs. And my program is an opiate treatment program in Midtown Manhattan. So I will tell you, when New York Medicaid redesign transitioned the behavioral health services into Medicaid Managed Care, and that was over a decade ago, as an association and as a provider, I was worried. But 10 years later, it was worse than I could possibly have imagined. Before the switch to Medicaid Managed Care, we would submit claims directly to New York State Medicaid, and every week we received our reimbursement for the services we provided for the prior 2 weeks. And I had anticipated that there would be bumps during the transition, but I didn't know that we would be struggling with constant denials for services that were properly rendered, for inaccurate payments consistently in the favor of the health plans, and that we would need additional employees just to manage managed care. I'll let you know we are still, today, waiting to receive the much-needed 2023 COLA. We don't have that yet. We're still waiting for managed care to pay that, which is really meant to keep pace with inflation. The Medicaid Managed Care plans had promised that they would save the state money by coordinating care and ensuring that accurate, timely payments were made. Well, that never materialized. And I suppose that's probably not really surprising, because health plans are accountable to their shareholders. We need this legislation. We need it to be passed, because the Medicaid system has to be accountable to the people that it's meant to serve. Thank you.
Thank you, Allegra. To put a fine point on it, a call to action to lawmakers who may be watching this. At the end of the day, these same people that are standing behind me, my peers, we come every year begging and pleading for cost of living adjustments and targeted inflationary increases that are small. And we beg and we beg. And then finally, the body has the ability and often appropriates funds. However, if providers on the ground with bills to pay and people to hire don't get that reimbursement for a year, that should really, really concern lawmakers. You are appropriating money that does not reach providers in a timely way. And because of that, they are unable to hire the workforce they need and meet demands for care in your communities. So please hear us. Pass this bill. Next up, David Boudrum from the Association for Community Living.
Good afternoon. My name is David Boudrum. I'm the Director of Governmental Affairs for the Association for Community Living, or ACL. ACL represents over 100 licensed and supportive mental health housing providers across New York State, serving about 50,000 New Yorkers living with serious mental illness. The residents our members serve rely every day on the outpatient behavioral health services and supports that remain trapped in a Medicaid managed care system that is too often slow, fragmented, and difficult to navigate. When access to treatment is delayed, when providers are buried in administrative barriers, and when reimbursement problems destabilize the broader behavioral health system, the impact is felt directly by the people living in our housing programs. People working to maintain recovery, stability, and community integration. And that's why ACL supports this bill and this effort to return these services to a more transparent and accountable fee-for-service system. At a time when behavioral health providers across New York are struggling with workforce shortages, rising demand, and limited resources, we should not be spending roughly $400 million a year on unnecessary insurance, administration, and bureaucracy. Those resources should be invested directly into behavioral health services, workforce support, housing stability, and access to care for the New Yorkers who need it most. Thank you.
And finally, Sarah Duvall from In Unity Alliance will join me here. Sarah? Oh,
Thank you,
there you
Lori.
are.
Yeah, Hi, my name is Sarah Duvall. I'm with Unity Alliance. Unity Alliance is an association that represents 150 substance use disorder and mental health community-based services. Many people don't know that substance use disorder and many mental health conditions are preventable, and that people can and do recover when they are able to access timely care and support. Like other health conditions, outcomes are far better when people receive prevention, early intervention, and treatment before their needs escalate to crisis levels. Timely access to care can help people remain connected to their communities, to their families, schools, work, and communities. And it dramatically changes the long-term trajectory of their lives, all at a much lower cost than crisis-driven care. Instead, we are seeing what my colleagues described, unnecessary obstacles resulting from Medicaid Managed Care organizations leading to delays, confusion, and disruptions at the very moment people are ready to seek help. Community-based services are being forced to divert their time and very limited resources away from direct care to navigate prior authorizations, denials, and inconsistent administrative requirements across many managed care organizations, each with its own unique processes and rules, and all of this time is unreimbursed. Clinicians want to spend time supporting people in treatment and recovery, not fighting to secure approvals or medically necessary care, while long waiting lists continue to grow. A Medicaid managed care carve-out would help create consistency, reduce unnecessary administrative complexity, and give people the highest chance of accessing this timely care. Thank you.
Thank you so much. This concludes the formal portion of the press conference. We're happy to answer any questions that you have. Please feel free to approach those of us who are standing here with signs in our hands, because we have a lot to say. Thank you for joining us today. Again, to lawmakers, a call to action. Before the end of this session, please, please, please put a vote on the floor, in your floor, for bill numbers A8309A, and in the Senate, it's 8055A. This reform is long overdue. Did I switch it? A8309 is not? Okay. S8309A and A8055A. I'm deeply sorry. Thank you. Thank you for being here with us today. Bye-bye.